Digital therapeutics has definitely captured a lot of hearts, minds, and pocketbooks. The global digital therapeutics market is estimated to grow 460 million by 2025, from 115 million in 2018. That's pretty impressive, 115 to 460. This next session is a real treat for all of you, not only wanting to understand digital medicines, but to see how one prolific company is changing the game. I'd like to welcome them to the stage and introduce Dr. Arsha Vahabzadeh. Thanks.
So as Jill said, digital therapeutics is such a hot topic, and it's a pleasure to have Dr. Eddie Martucci of Akili Therapeutics here to give us some of his insights into what he's doing and what he thinks the future of digital therapeutics will look like. So great to have you here.
Great, happy to be here, and thanks everyone. Good morning.
A lot of people have kind of asked me, when you say digital therapeutics, what does that mean? I guess, what does that mean to you, since you're doing so much work in the space?
Sure. And digital therapeutics has become a bit of a catch-all term. I definitely hear at least 30% of what people mention as digital therapeutics are not actually digital therapeutics, in my opinion. We kind of founded Akili about 7-8 years ago with the idea that software could not just impact health, but could actually be the medicine, for lack of a better word. And I think that's what we mean by digital therapeutics. I do think there's a bit of a broad definition now, which is a good thing, that digital has the potential to do a lot of different things for healthcare. And what I consider digital therapeutics, this is as Akili, I'm also one of the founders and the chairman of the Digital Therapeutic Alliance. It's when software is used to have a direct impact on outcomes, on healthcare outcomes, on care outcomes. So a lot of digital things are kind of supporting today's medicine or for patient engagement, and that might indirectly have a health outcome, but I think what we're talking about is software that can directly impact patient outcomes. In Akili's case, we like to be a little crazy on the front end of things, and we like to say the software in and of itself can be therapeutic. Meaning you use the software, you get a therapeutic benefit. That's what we're doing, and that's what I'm excited about seeing more and more in the world today.
I guess I wanted to touch on a little bit on that, the Digital Therapeutic Alliance. What is that, and how is that kind of trying to progress or advance the field?
Yeah, it's been a great, about 2 years since this alliance was formed. It's excellent for the industry, it's excellent for healthcare and for care paradigms. What it is now is actually dozens of companies banding together to form the first industry alliance that's agnostic of any one company lobbying for their position, but is really about the awareness and ideally helping to spur the adoption of digital technologies in all different areas of healthcare. So there's a set of core founding companies, Akili, WellDoc, and Voluntis, and a few others that sort of kicked this off a few years ago, but it's grown pretty tremendously, and so you have a few dozen digital therapeutic companies, both in the US and ex-US. You also have a number of pharmaceutical companies, a few health insurers, a few providers and clinics that are banding together, and I think what you'll see is ideally the first year and a half was a lot about standard setting and definition, so that the world will start to understand a bit more of what is good and bad in the space, right? Having data, investing in clinical research, having the security and privacy nailed down. I think trying to define those fundamental frameworks, those fundamental cement stands, if you will. And I think what we'll see going forward is that there will be a big push to try to educate the world to get this integrated into mainstream healthcare and mainstream medicine.
What kind of validation are you going to need to do that? What is the standard? I mean, you're aiming at a particular standard through Akili,
sure.
But what do you see as the kind of minimum standard that people need for this field?
Yeah, we're a bit extreme in our standards. We said early on from day one, and most people looked at us like we're crazy, but we said that a digital technology, if it's having direct therapeutic outcomes, should be studied like any other technology, or for that matter, drug that has direct therapeutic outcomes. People were worried about that. It takes a long time, it's expensive, and how the hell do you run a clinical trial with a video game, in our case? But you can. The answer is you absolutely can. So it's critical to us that, that clinical validation, the type of clinical trials you run, whatever population you're studying, a diagnosed disease population, a subclinical population, that you run good, solid trials with good endpoints, really definitively demonstrating and proving the benefit that your technology has. If we want these things to be used in mainstream care more generally, I think for not just your doctor or your insurance company, but quite frankly for the educated consumer who needs to be able to trust what's happening, there needs to be a level of evidence that's high. So that's my bias, but my hope is that we're going to see the level of evidence rise in digital therapeutics and not fall to a lowest common denominator. What that means is real clinical trials. You have to invest in them. They take time. I hope what it means is innovative clinical trials, where we can actually use the best of digital to be quicker and more scalable about generating data. Certainly what we're seeing in the policy side of the world is there's, at least on the policy side, an acceptance of technology speeding to market and collecting real-world market data to validate. But the bar has to be high. I think the bar has to be really high. The one clear thing here about digital is there will be a lot of noise. And when you don't have good technologies coming to market with solid evidence, the noise proliferates. The crap on the market proliferates, and it's harmful to people that are in need. So we need to invest in technologies that will actually have solid evidence so that that becomes the standard and that becomes the pathway to having products that are really used, or else you're left to use nothing or to use things that do not have a benefit or haven't shown it.
You mentioned that obviously there's some digital aids that are enhancing current therapies, but you see digital as being able to really just provide therapy itself. What is it that digital might be able to do that normal kind of small molecules or normal medications or pills in a bottle won't be able to deliver?
Yeah, that's my favorite thing to talk about. It's where I think the
That's why I asked there, because I know.
Thank you, I know, I'm glad. It's a good thing we know each other. You might have asked me something I hate to talk about. This is, I think it's on the slide over here. So this is kind of one of my favorite phrases is we need to move, I believe, we need to move from what is enhancing today's medicine or doing what today's medicine can do a little bit better to using digital to do what today's medicine can't do. And that's something we invest in heavily. It's the foundation of our company. So I'll give you the example. You're looking for examples.
Yeah.
We think what we specialize in is cognitive care. We're trying to directly impact cognitive issues, cognitive dysfunction and impairments. These are things like attention, memory, and other basic cognitive processes that are essentially impaired in millions and millions of people, some with disease, some without disease, but significantly impaired. This has been an area that's essentially intractable in the medicine world. There are a few small molecules that by random chance have been able to show some cognitive boosts, but they do not directly target the underlying cognitive issue, and they have massive off-pathway effects because the way molecules work is a population-based spreading of receptors in the brain, which is actually the area I came from initially in my training. What we're able to do with technology, with very specifically designed and targeted sensory and motor stimulus, is directly activate key cognitive networks through digital means and not activate everything else in the brain. So specifically activating the key networks that we want to, leading to, you can study it, and we have, leading to demonstrated changes in the brain and the follow-on effects on cognitive outcomes and in some case behavioral and disease outcomes. That's the type of targeting that you can't do with molecules, or at least today we haven't figured out how to do it. So one, I think, area is you can target physiology in a brand new way, and so that's one bucket. The other big bucket that I get really excited about is how do we use the best of digital to do what medicine can't? And so whether it's the delivery in a captivating, we overinvest, a lot of people think, I think it's a proper investment in making our products feel in the moment like a high-end consumer entertainment product. Because why does medicine have to feel cold? Like we've boxed ourselves in there. The data you can collect from from medicine. We say, let's collect every bit of it. We collect frame rate data, so 30 times a second data from someone using our products, so that we can do incredibly advanced data analytics to understand not just is someone using, but how are they using our products. These all lead together to say we can target physiology in a new way, we can measure things in a new way, and I think what we're doing is important, but it's really just the tip of the iceberg.
Right.
I think what I hope is we're going to see a proliferation of technologies and companies that are really embracing this and saying, let's not box ourselves into doing today's medicine better. Let's go way beyond.
Regarding the apps, we talked previously just amongst ourselves about if you have a bottle of medication, you will assess something like adherence by figuring out, is the patient taking that medicine, yes or no, a kind of binary way, and what's the outcome. But with digital, it sounds like you can do more than is someone just opening the app. What kind of insights have you got from...
I'm trying to think how much I can talk about this. We haven't made a lot of it public. Yes, you can. You can do a lot more. So you got me going. Now I'm just going to talk.
It's coming.
So yes, in pills today, there's 2 companies I think that I know of that are at least trying to go beyond have you just opened the pill bottle to has it actually been swallowed. And there's not a lot of incentive for the end user there, actually. There's not like really incentive or engagement. We can do things like we know exactly when, and I mean we in digital broadly, certainly Akili, but digital broadly. We have the opportunity, all of us here who care about digital products, to know if it's opened, if it's used, exactly when it's used, how progress is going, but way beyond that. That's, I think, what people are starting to get today and starting to use. So our data science team is really psyched, and I'm going to keep it at a vague level, but really psyched about using the rich data that we get, on the hundreds of milliseconds level to create a fingerprint, using machine learning and advanced classification, to create a fingerprint of how someone's engaging so that you can classify, are they opening the product and going through the motions, or are they actually deeply, heavily engaged in the experience? A little known thing in digital therapeutics is that use of the product, just general compliance use, has not shown strong correlation with outcomes. There's not a good predictive value of generally with compliance and outcomes. What we're seeing for the first time is that classification of how someone's using and deep engagement level starts to predict outcomes. The cool thing is not only can we take that information and say, we now know something that we didn't know before, we can actually do something about it. Because the products are digital, you can, in the moment, as an example, flash up a reminder to a child who's sitting on his couch like this child and playing something. You can flash up a reminder and say, hold on a second, not engaging. You can flash up a same reminder to that child's parent or caregiver. The really cool future, which we're not doing yet, but we hope to do, is when you learn that someone is engaging in a way that's not predictive of benefit, in the moment, can you adapt the experience to incentivize them and get them to engage in a way that will actually lead to the benefit? This is that's futuristic from a medicine perspective. You can't...
Because molecules, you can't do that.
Yeah.
You need a few decade or so.
You can't even change really what the pill tastes like, right? You can't change
It's
colors.
not fun.
And these are levers you don't have to pull in today's medicine that you have in spades in digital, and we should be doing everything we can to use every one of them.
I can mention fun a little bit. Gamification, it's often mentioned. I know that Akili's actually got some very good experts in gamification and actually just making the experience fun, engaging. What does gamification mean to you, and what are you doing to kind of really push that to be a kind of the high standard?
Yeah, so I hate the word gamification. I think it's been overused.
That's why I said it.
I know you did. It's very provocative. You wanted to get my blood pressure. Gamification has generally been used to mean take an experience and then put some game features on it so that it's a little fun. What we like to do is start with the end user. What does the end user want? The end user doesn't want something that's packaged up and then has a little bit of sprinkles on top. In technology, the end user wants something that directly caters to their visceral experience, that gives them a solid experience. So patients are end users. Just because people are patients, a lot of medicine has kind of paternalized and say, well, you might want a pleasing experience, but that's not how medicine works, and we're going to tell you what works, and you should use this even though it's unpleasant. That's crazy, and it's especially crazy when you have a digital product. So what we've done, and where I see more and more of this now on a daily basis, which is great in the field, we've invested equally, actually, if you break down our spend in development and headcount and things like that, we're roughly equal in science and clinical and cognitive science and game development, experience development, web and mobile technology development. And what we do is from the very earliest days of developing an experience, we're bringing those both together. So this is not something where you're developing a core technology that's cold and sprinkling something on top, infused into the actual development of the experience with iterative cycles of user testing and focus and learning what the user needs and wants. We're actually developing engagement and high-level captivating experiences as part and parcel of the core technology.
So you're aiming to give the benefit of medication or therapeutic, but without the horrible taste and the boring experience and
yeah,
changing?
Yes, and I think we have to respect people a little bit more. I mean, all of us here are using technology. Half of us have our phones out, and I'll say you're 90% listening to me, but it's probably more like 50%, but that's okay. But most of us have our phones in our hands. Think about how you use something. If it's not a seamless, simple, easy-to-use experience at a deep level, I mean, think about how every app that you use, that company, how deeply they've invested in user experience and user design. You can't tell someone, well, here's a kind of B- experience, but it's going to be beneficial for you, so just use it. Would any of us in here raise our hands and say, oh yeah, absolutely? No. Right. It turns out humans don't want that, they don't do that. So let's respect that people can see through an experience that looks like it was designed to be good, but is really not good. People are way too advanced for that, and again, we tend to, in this world, do beautiful experiences for every industry, if you will, every experience of consumers except medicine. We should be bringing that to medicine.
Even the electronic medical records are terrible. I just wish Apple, somebody invested someone to help that out.
Yeah, totally different story.
We say digital health, or digital medicine. At what point does it just turn to health, just turn to medicine, and we just drop the digital because it's so seamless, so integrated? And what do we need to do to get there?
I love that statement. I love that statement. At the end of the day, things should just be, if they're helpful for people and they can be used in care, they should be medicine. I think we have an opportunity as people who are working in the digital field. Most people here are digital pioneers in some way or other. I think we have an opportunity, and then I'd go farther and say an obligation, to actually change the mindset of the medical system. And I mean that in a couple different ways. We're seeing this already in the world where, as an example, we have big players in medicine who are like insurance companies and others who are finally pushing to say, let's not just care for people once they're diagnosed and sick, let's care for them and healthy, right? It's just care, as you and I talked about, not health care. It's total care. That's one sort of thing that's already happening in society. I think with digital, when it's doing something new, we have to invest in educating and making people aware of how things are different. So I'll give you a very specific example with what we do. Again, we're targeting cognitive function. This is not something that's been addressed in the current medical system. Cognitive deficits don't even classify as a disease condition, even though we know from research that the major impacts that cognitive dysfunction have, they're as big as any other observable symptom of a disorder on prediction of quality of life, yet they don't fit into a disease classification. And so
maybe we just didn't have the tools that we're developing now to get that data.
I don't think we have the tools. I don't think we had enough people working on it, maybe. But everything's coming together, and we, as a company, as an example, could sit here and say, well, the medical system doesn't really, understand cognition, and when they look at a person, they want to look at a patient and the old ways that you look at their symptomology, and we could accept that, or we could not accept that. And we could say we have to do the work, which takes time and it could be expensive, but we have to do the work with all the stakeholders in the medical system, be that regulators, be that insurance companies, be it others, to actually educate. I think the big lever that we have and that digital has an opportunity and obligation for is to work with patients and stakeholders that have in some ways been ostracized from medicine,
Right.
and actually should be brought into the process to help educate. So what we're starting to do, this is something I'm very excited about as we have our products approaching market, is we're starting to bring together and work with strategic partners who typically have been thought of at the end stage of once something is done, it's on the market, it's being used, now you go consult them. So I'm talking about clinics, I'm talking about provider systems, I'm talking about schools, where we want to do a few of these partnerships earlier in an early access phase for our products to start to actually collect the data, the input, and the voice of patients and caregivers and providers in real world settings so we can mesh the real world data and benefit with the clinical type benefit you see. I think those are the steps that need to be taken. So by the way, find our team members and talk to us if it's something you're interested in. But I think that's the type of investment that needs to be done to really bring the new voice into medicine and to take on entrenched medical thinking and push it forward.
Well, I think you're really pioneering this path for science, a product, and also how to send this out and distribute this and get people excited. Well, thank you very much, Eddie. You're doing great work. And just a round of applause
Appreciate it.
for Dr. Martucci and Akili.
Thanks.